Walk into nearly any grocery store or restaurant, and you'll see walls lined with beer, wine, hard seltzers, and spirits. In almost every country, drinking is woven into almost every social setting. But that normalization masks an uncomfortable truth. Alcohol is one of the most addictive and destructive substances. According to the Substance Abuse and Mental Health Services Administration, known as SAMHSA, about 1 in 10 Americans ages 12 and older suffer from alcohol use disorder. For Christopher Nahara, this slow slide into addiction started in his hometown of El Paso, Texas, a city on the western tip of Texas that shares a border with Mexico.
It's a Hispanic culture, and drinking is really prevalent in all our culture here. It's in birthdays, it's in celebrations, it's in weekend gatherings. It's pretty much norm. And you can be, the drinking age in Mexico is 18. So you can go over the bridge, and we were making fake IDs at 17, going over there and started drinking.
Throughout his 20s, Nahara says he drank like most other people he knew, on the weekends, at bars, or with friends after work. He was a college athlete who was fit, ate healthy, and after college worked a full-time job in TV. Alcohol wasn't a problem until it was.
COVID 2020 hit, and that's when I really started drinking a lot more at home. And it became, after right around that time, it became an everyday use. And in the end, I couldn't stop. And then I couldn't stop. And it was like being on autopilot. I mean, it was like when I was in treatment center, I would talk to the doctors and I would talk this and to different people, and they witnessed the same thing, where it's like you're on autopilot and your brain is going to do whatever it takes. It thinks it needs it like water and food. And so you're like, I don't want to drink, but you were driving yourself to the liquor store.
At the peak of his addiction, Nahara would drink a pint of whiskey and around 5 or 6 beers every day or every other day. Looking back, he shares what he lost through alcohol. And this slow, damaging slide into chronic alcohol consumption can happen to anyone. Dr. Corey Hayskamp is an emergency medicine physician at Northwestern Memorial Hospital in Chicago and explains how addiction is often a mix of several factors.
Whether or not people become addicted to alcohol just based on genetics or consuming alcohol is hard to say. I think it's more likely a combination of environmental factors. So upbringing, current living situations, stressors. I think a lot of people find comfort in alcohol.
Hayskamp is also a postdoctoral research fellow in health and outcome services at Northwestern. His research focuses on improving treatments for substance abuse disorders.
Alcohol essentially is toxic to your body, whether people want to accept that fact or not. It's literally a poison, and that's why you feel the effect of feeling drunk. And so chronic consumption, like I said, your liver metabolizes alcohol. So over time, having to chronically metabolize alcohol, your liver starts to become damaged, and your liver is responsible for production of essential proteins for your body and different enzymes. So that becomes problematic.
He says it's often hard to pinpoint when someone has an alcohol addiction in a busy emergency room when he's seeing patients for only a few minutes at a time. However, this picture becomes clearer when he has the chance to spend more time with someone, or if they frequently visit the same ER while inebriated or are in withdrawal.
I think part of the issue is identifying people in the ER who have alcohol use disorder versus someone who maybe just drank a little too much and needed somewhere to sleep, but doesn't necessarily have alcohol use disorder. Alcohol withdrawal is a little different. Once someone develops dependence on alcohol, their neurons change in the way they use excitatory and inhibitory, or their body basically elicits excitatory and inhibitory hormones and neuronal activity. And so alcohol is a depressant. And if you chronically use a depressant, you're depressing your brain activity and your bodily functions. And when you take away that depressant, your body becomes like hyperactive essentially. And so they come in, they can't stop shaking, their heart rate's probably really high, they're probably sweating.
In cases of severe alcohol dependence, People can develop widespread vitamin deficiencies that lead to confusion, memory loss, and mobility issues. Nahara shares some of what he went through.
I think towards the end of my drinking, the blackouts started happening, and I would wake up and be like, okay, where's my wallet? How much did I spend last night? What happened? That's when it starts becoming alarming. That's when it's like, okay, I need to do something. But here's the thing is I would try to stop. I would say, okay, yeah, I'm going to cut back. But then here comes 2, 3 days come by, the withdrawals kick in, your mind's craving it, you maybe get a little bit of shakes and you're like, oh, you know what? You start craving it. Your mind starts craving it. The dopamine GABA receptors are craving that lack of chemistry. And so you turn to the alcohol, and it's the addiction. The addiction set in just from the repetition, the years of drinking. And that's it happens to millions of people. And they don't even know they're into the addiction. And that's what happened to me as well.
For many, reaching this acceptance is when they're ready to seek help. But treatment for alcohol addiction in the U.S. can be difficult to access and costly, especially for inpatient or outpatient rehab programs. Hazekamp says the most effective medication in treating alcohol addiction today is naltrexone, which blocks certain receptors in the brain responsible for craving and euphoria. Despite its efficacy, it's still underprescribed.
Number one, you need providers willing to treat alcohol use disorder, which isn't that common. Some people might think it's a primary care physician's job. Some people might think it's more along the lines of an addiction medicine provider. And so you have to, if you're someone who is seeking treatment with pharmacological agents for alcohol use disorder, you have to find a provider that's willing to use these medicines. And to find a provider that's willing to do that, you have to find someone who's comfortable with that. And so that kind of starts with like training doctors earlier on to treat alcohol use disorder, which isn't very common. I think also people likely get introduced to these medications at rehabilitation centers. And so it just depends on, unfortunately, I think the problem is like this has probably been commonly used and widely available for people who have private health insurance or commercial health insurance, who are affluent and have means to an end, that can afford to go to quote unquote functional rehab center and be introduced to these medications versus someone who maybe doesn't have any really financial means.
For Nahara, finding help took persistence. After years of drinking, he found the right outpatient program for him with a medical treatment plan.
I needed medication to stop. My dopamine and serotonin levels in my brain were completely out of whack. And that's why I was having the cravings and the urges to drink. But what the medications that they gave me, and I'm not a doctor, I can't tell you what medications for you to take, but a provider that deals with addiction can provide medication to help those serotonin, dopamine levels and balance your cravings out.
Hazekamp says that he and other doctors are working to start these medications earlier and ideally at the point of crisis in the ER when patients are most motivated to get sober. Today, Nahara is celebrating almost 2.5 years sober and says his life looks completely different.
At 1 year sober, alcohol-free, is when I really started seeing the game change and how everything started becoming more clear. My relationships started coming back, with my family, and everything started changing for me, and everything started going on the up, which, like I said, all the things that it stilled, killed, and destroyed was starting to come back to me. And it was because I stopped. And the clarity when my mind, it was almost like the phase and the haze of all the alcohol started dissipating and everything started becoming clear. My thoughts started coming clear, but it was at that 1 year mark. And now 2 years and 4 months, I still have liver issues. And that's why I'm saying like the repercussions could be long-term. And I'm still dealing with pause. I'm dropping things and all due from the alcohol, how it's destroyed me. And so I'm still 2 years and dealing with some of the repercussions, but it was at that 1 year mark that really made the difference.
With the holiday season and all the gatherings this time of year, it can be easy to drink more than usual. Hazekamp says it's an important moment to check in with yourself and be mindful of how much you're drinking. He refers to a metric that Alcoholics Anonymous uses.
So if you're thinking you're going to have 1 or 2 drinks with your family and go and black out despite trying to control your consumption, that might be a red flag. and a good reason to maybe look into treatment. The other one would be attempting to stop drinking completely and being unable to stay stopped. So if you're heading into the holidays and thinking, I'm just not going to drink, but you're completely unable to not drink, and you do drink, then I think those are two easy ways to kind of conceptualize at least how AA defines alcoholism, which I think is a good starting point for some people.
Addiction can often feel isolating, but no one has to face it alone. If you or someone you know is struggling with alcohol addiction, you can call the Substance Abuse and Mental Health Services Administration helpline at 1-800-662-HELP or visit findtreatment.gov. To learn more about Alcoholics Anonymous and locate meetings near you, head to a-a.org. Also, check out Christopher Nahara's book, The Hard Truth: Stopping Alcohol, now available online. You can find a link to the book and other resources by visiting our website, viewpointsradio.org. For more behind the scenes and to support our show, follow us on Instagram, Facebook, and X by searching Viewpoints Radio. This segment was written by our executive producer, Amira Zaveri. Our studio manager is Jason Dickey. I'm Marty Peterson.